Medicabil Hospital, and I have been in medical tourism field around 10 years. And I'm not a medical person like three of you. Neither me nor Mrs. Elena is not medical person, but we have a good experience in medical field. From my side, around 10 years. From Mrs. Elena's side, more than 5 years. And I have never been in any other hospital before. I started to work in Medicabil, and stay we are here. Mrs. Elena was having an experience in other hospitals before, and also it's our chance that she joined our team a short time ago. That's why we would like to introduce our healthcare service in different areas, not only for the Middle East or the Balkan countries, for example, but also at the same time in the area of Russia, Ukraine, the CIS countries as well. About Mrs. Nigar, I would like to say you that I was in Azerbaijan, in Baku, let's say maybe more than 100 times before, especially before the time of pandemic.
Yeah.
We had a network office in Baku. Maybe you remember the place we called it Gençlik.
Of course, I know.
Yeah, Gençlik. When you go from Gençlik to Ayna Sultanova, there's a clinic that they call Istanbul Enes Klinik. Istanbul Enes Klinik.
So I know Gençlik and Ayna Sultanova, but actually I don't know. I've never heard about this clinic.
Okay.
But maybe.
Yeah. So we have very good experience in Azerbaijan market, but currently on the time of pandemic, because of this travel difficulties, we started to pause our office, and now we didn't open it yet. But in different countries, through our contacts, some of them are doctors like Vadim, for example, or some of them professionals of this business like you, for example, and they are referring patients to us, and we are trying to help them, and we are trying to make them much better. Let me explain you about Medicabil Hospital shortly. I don't want to take your time so much, but I think that I'm pushing Mrs. Maria many times. Please go ahead. Please do something with us. But unfortunately, we couldn't move to the second step yet. That's why I thought that maybe there's a lack of information on you about Medicabil. That's why I kindly requested this meeting to introduce ourselves a bit deeply, but briefly. We established in 2011 in Bursa. The owner of our hospital is a medical person. He's an orthopedic surgeon, and he has experience in orthopedic and traumatology, especially on joint replacement surgeries. Shoulder, hip, knee replacement surgeries. More than 35 years, his experience. And he was the chief doctor in Uludağ University Hospital. Later on, he decided to retire from University Hospital and established Medicabil in 2011. About the quality of the Medicabil, not only on the side of the healthcare quality, but also for the international accreditations like GCI. We are the first private hospital in Bursa who was accredited by GCI in 2013. And then it was renewed in 2016 back. Later on, nowadays, we are currently applied for the re-accreditation by GCI. And in order to present ourselves for the third parties who had never knowledge about Medicabil, that we are doing international activities under the respectful of the international standards. That's why we decided to renew it, although it was over 2019. On the other side, for the patients that who are preferring the foreign patients who are preferring our hospital is, let's say that we are a general hospital. First of all, I can tell you we are a general hospital, but on international marketing side, we focused on three main branches: orthopedy and traumatology, neurosurgery, and general surgery. Not chest surgeries, pulmonary surgeries, Dr. Vadim. But from our side, why orthopedic and traumatology? Let me say about this. Because the owner of our hospital is orthopedic surgeon, and his target, his aim was to establish, to create a center of a hospital which is going to be a center for orthopedic and traumatology. That's why when he was designing the team of orthopedic doctors, he transferred a design from the system of Cornell University in US. When he was in the time of fellowship, he completed his fellowship degree in US in 1993, by the way, 1993, and his fellowship was completed under the supervision of one famous orthopedic surgeon. His name is Ranawat, Dr. Ranawat, and he is currently above 80 years, maybe 85 years old. But when he was working actively, was one of the best orthopedic surgeon in US. I mean, he was very popular, and he was very popular patients like Pavarotti, like W. Bush. They were his patients. On the other side, he has own methods, own techniques, which was proved scientifically and published on the articles, magazines. He has a own technique. I mean, he became a part of the literature. So what was he decide? He planned in Cornell University, Dr. Ranawat. He decided to focus of each sub-branches in orthopedy. Let's say that one doctor is specialized on just for joint replacement surgeries. One doctor is just for trauma surgeries. One for just spine. One for just arthroscopy, for example. So when Dr. Ömer was establishing Medicabil in 2011, he transferred the same model to Medicabil. Currently, we hire around 8 orthopedic surgeons here, and each of them is specialized on one sub-branch of orthopedy. Let's say that Dr. Ömer is doing only joint replacement surgeries. Another surgeon is just for spine. Another one is just for trauma, arthroscopy, pediatric orthopedy, like this. So this subspecialization improving the quality of the surgeries as well. Because once you are going to motivate on one side, so you are going to be more careful. You are going to be more talentful to do some surgeries. So now we are getting the benefit of this idea. With our 13, 14 years of experience, the patients are preferring our hospital mainly for orthopedy and traumatology. This is one side. Excuse me, by the way. Excuse me, the weather is a bit warm here today. I'm a bit hot now. On the other side, about spinal surgeries, for example, spinal surgeries, we have another surgeon who is doing pediatric spine surgeries like spinal cord surgeries, like tethered cord, spina bifida, or pediatric congenital diseases, neurosurgical diseases, cranial surgeries, and scoliosis, kyphosis. We do all of them with this surgeon. And for the pediatric orthopedic surgeries, there are some diseases which comes congenital problems. Also, we are doing those surgeries. And for the Dr. Ömer side, for international patients, I can tell you like this. For example, for primary hip replacement, knee replacement surgeries are doing in all countries, like in Azerbaijan, like in Ukraine, for example, or in Iraq, for example. But the thing is, for the revision cases, revision surgeries, I mean, revision means that the patient operated before and still having pain and needs revision surgeries. We are doing those revision surgeries in our hospital by Dr. Ömer. Also, we have robotic systems, robotic arthroplasty surgeries, robotic joint, hip joint and knee joint surgeries we do. we are using an American company, Stryker. The robot comes from Stryker, and we are using this is our installed in our hospital, by the way. And for example, tumor cases, bone tumor cases, because of the lack of equipments in different countries, we are making a custom-made implant in Germany for these patients and doing the surgeries in our hospital. Let's say that a patient has a tumor on his pelvis bone, for example, and the standard prostheses are not suitable for this patient. So at that time, we are taking the tomography, the CT of patient, 3D CT of the patient, and sending this result of CT to Germany, and they are producing a custom-made prostheses and sending to us. And then we are making this, we are putting this the prostheses to patients. I can send you some X-rays about those kind of surgeries. It will be in my presentations in different places, especially with the scientific people. I'm using those X-rays, and they are directly affecting the perception of the people about Medicabil. On the other side, also for the, I mean, I'm not talking about hair transplantation or obesity surgeries. Also, we are doing all of them, by the way. I mean, if you have any patients, please feel free to ask them to us. And all abdominal tumor surgeries, for example, about the general surgeries, abdominal tumor surgeries we do. And thanks to our oncological department, we are also having the service of medical oncology like chemotherapy or immunotherapy, or maybe in some cases we are giving chemotherapy. We call this hot chemotherapy during the surgery, and we had this having the system of 3D navigation system. This is two parts, one side for the spine navigation, one side for the cranial navigation. For the cranial navigation, it navigates, the device navigates the location of tumor properly. That's why for the pre-planning of the surgery, it is very helpful to decide the location of the tumor for the surgeon. So, I mean, this kind of services we are giving, and we are always ready to cooperate with your company. Really, I mean, as we are locating in Bursa, it is not so far away, by the way. Maybe any of you never been in Bursa before. But Bursa is not so far away. I mean, from Sabiha Gökçen Airport, the second airport in Istanbul, we are getting our patients and bringing them to hospital by VIP car. It takes around, let's say, 70 minutes, around 1 hour. Or on the other scenario, for the Istanbul New Airport, there is a highway directed from Istanbul Airport to Bursa. That's why it takes around 2 hours. It is not so far away. As you know, Istanbul is like a country. When you landed to Sabiha Gökçen Airport and decide to go to the European side, on the time of traffic jam, it will be catastrophic for you. More than 2 hours, more than maybe 1 hour. Really?
Samet,
It
they
is.
have radiotherapy.
Radiation oncology.
Radiation oncology, yes.
Radiation oncology, Maria, we don't have, unfortunately. We don't have. But for the chemotherapy and immunotherapy and surgical oncology, we are giving service. And for the patients who need radiation oncology, there's another third-party solution center here. We are referring our patients with our team, with our driver and translator, and getting the radiotherapy there, and again coming back to our hospital. We can manage this. Like you can at that time you can decide Medicabil hospital like a medical tourism agency. We can handle this. Don't worry.
Okay.
Okay.
If you have any question, please feel free to ask me. And Mrs. Nigar, we have some VIP patients from Azerbaijan before. There is one, they call this, her name is Bahar Muradova, and deputat. In your language,
Maybe,
she is
maybe.
she is deputat, and she came here for spine surgery before, and her husband for total hip replacement. They
Oh,
came here.
maybe, but I don't know them.
Yeah, we have many patients in Azerbaijan. Azerbaijan was one of our pioneer markets before pandemic.
Do you
How
do
long have you?
rhizotomia? Do you
Excuse
do
me?
rhizotomy for pediatric patients?
Immunotherapy.
Rhizotomy.
Rhizotomy.
What is this?
Rhizotomy.
Rhizotomy. What is this? I didn't.
Cerebral
It's
palsy treatment.
CP. Yes. CP unit. We have. We have two options here for treatment: one surgical, one rehabilitation. CP rehabilitation. I will send you our presentation, the video presentation about CP patients after the meeting.
Okay.
We have two physiotherapists, and they are giving CP treatment.
You have a rehabilitation center inside Medicabil?
Yes, we have. We have around 24 boxes in our physical therapy unit.
So you can offer a program like a physiotherapy rehabilitation, right?
We can offer, Nigar, but let me do like this. I mean, we are not a rehabilitation hospital mainly.
Okay.
There is some rehabilitation hospitals like Maria, you know, in Istanbul.
Ramatem.
Yeah, Ramatem and
Romatem.
Nobel.
Romatem is our counter partner, on the time a cooperation partner for many projects. For example, the Libyan army patients, we treated them together with them. The surgical side in Medicabil, the rehabilitation side in
Okay.
Romatem.
I
Same as, unfortunately, Nigar, the Armenia and Azerbaijan war. The people
Yeah.
from Azerbaijan, the soldiers from Azerbaijan, they came to us, and we treated them through with Romatem.
Okay.
And also for the project of Iraq, Iraq army patients, we treated them together as well.
I see.
So,
Ukrainian patients
when,
doesn't have money, sorry.
yes,
Ukrainian
yes,
soldiers, the government don't pay.
yeah. On our website, on your website, I saw that you are collecting money for the pediatric patients as well, and spending those money for the treatment of patients.
Right. Before we cooperated a lot with German Foundation. Now the
Yes.
German Foundation don't help to Turkish countries, to Turkey, and there is another Polish foundation that helps to collect money, but the process is a bit more difficult and long, but still it is possible.
We had one patient from Russia. She was a pediatric patient, and she came to us for amputation surgery, and her treatment was totally paid by a foundation in Russia.
Yeah, it happens. Before we covered a lot the treatment for our patients with German Foundation. Now it's mostly for oncology patients because it takes more than 1 month to make the collection. That's why we take this fund only for a long time or big price surgeries.
I see. So, among the profile of your patients, can you tell me the distribution surgeries he do,
Okay.
balloons, stomach balloons, and we can maybe go ahead with these surgeries. I mean, if there's a demand in the market, so why don't we provide our services there?
Yeah, exactly. And do we have any package for this kind of surgeries? So the fixed prices, I don't know, for gastric sleeve or for balloons or
Yeah.
for hair transplant?
Yeah, for gastric sleeve, we were quoting really rock bottom prices, around 3,500 euro. We were quoting 3,500 euro. But for the case, it's also the commission included. And for the hair transplantation, around let's say 1,800, depends on the time of the stay in Turkey.
Okay, and does this price include hotel accommodation
For which one?
for hair transplant or gastric sleeve?
I mean, a hotel stay, for gastric sleeve, we are keeping the patients in the hospital, let's say 2 days after the surgery. And
Okay.
before we discharge, we let them to go to their country, let's say 5, 6 days after the surgery. During that time, we can arrange hotel for them. But I mean, if you say that, Samet, this price must have to include hotel stay as well. So we can continue with these prices and
Okay.
hotel stay included. We will not ask any for extra charge. And same as for the hair transplantation.
Okay, I see. So can you just send me out to us this prices package so then it will help us?
Okay, Nigar. I'm taking my note and send to you.
Yeah, please. And regarding the patients for treatment, so how it will work? So we just send you the patient's cases, and then I'm sorry, we're just waiting for your response for consultation with the doctor, and for every case, so we'll get the
Right.
prices, right?
Case by case.
Okay.
But
Okay, I see.
while you are talking with the patient, maybe we can give some
Yeah,
range
that's
of
why I'm
prices.
asking. Because for chemotherapy or I don't know for prosthesis
Yes.
surgeries, so there will some range. It will help us.
Okay. So we will send you the prices
Yeah,
with range.
please.
And about the the